The Ministry of Health and Social Welfare has received a consignment of medical items from the World Health Organization, now presented at the Central Medical Stores Complex in Kotu. The consignment is intended to boost the country's healthcare service in the country. The WHO representative, Dr. Desta Trone, said the supply was provided through partnership with the multiple countries. Let's have more of that in this report.
The medical consignment is inspired by a robust pandemic response and strategy implementation that aims to strengthen and improve public health systems in the Gambia after the coronavirus pandemic. Dr. Desta Turini, Country Director of WHO, speaks about the consignment.
Items being donated today range from surgical masks, disposable gloves, triple packaging, isothermal cryo boxes, freezer boxes, fridges, and this is showing a true solidarity around the globe. These items are originated from, some are from China, some are from India, some are from United Arab Emirates, but the origins could be quite diverse. United Arab Emirates, because WHO has a hub there, so some of them were dispatched from there. Otherwise, the origin could be from different parts of the world. The combined value, just estimated value of some of the items here is worth 217,000 euros.
He said the pandemic has caused difficulty for countries around the globe, including the Gambia, while underscoring the importance of strong healthcare systems. Minister of Health, Dr. Ahmed Samate, appreciated the efforts of the UN to ensure Gambia's response to the COVID-19, saying health is a collective responsibility.
In ensuring that the Gambia responds to COVID-19 adequately. It had not been easy. We've all been having sleepless nights. We've all been spending long hours working together. We've all been having weekends, late nights, including you, the journalists who have been there, covering all the activities of the COVID-19 response. But this goes to show that no one can do it all by himself or herself. No one can do it alone. And partnerships are beneficial. Partnerships within the government, partnerships between the government and partner agencies, international agencies, partnership between the government and civil society, partnership between the government and the communities. Without that, we cannot win. And health is a collective responsibility because the government can do whatever it needs to do. The government can provide the services, it can provide the equipment, it can provide the vaccines, the medications, but the health-seeking behavior of the citizenry is equally important because nobody can force a person to seek for health care. You can only encourage them, you can only tell them the benefits, you can guide them, you can make it available to them, but at the end of the day, it is an individual's responsibility to ensure that he or his family is healthy.
He said the pandemic response was a success because of good leadership and commitment, but noted that there were challenges. Minister Samade called for continued strengthening of the health system that includes citizens getting vaccinated for in case another wave of COVID rises. Aside from technical assistance, the WHO has also provided support for the ministry. For Eyeafrica News, I am Mafuji Sise.